Adam, let's talk firstly about cow's milk allergy. So how would you sort of first notice that, or what exactly is it? Tell us a little bit about it.
Well, cow's milk allergy is when your immune system, for reasons that we don't really understand, decides that it doesn't like cow's milk. And of course, cow's milk is the main component of baby formula. So it will often become apparent as soon as a baby for the first time has a bottle of milk. Now, sometimes it's very obvious. The child will have the milk and then straight away there'll be swelling of the lips, itchy rash, redness, and it's pretty obvious there's a problem with milk. But the thing with cow's milk allergy is it's not always that obvious, and sometimes it can be quite subtle. And what that means in practice is that the child will continue to have milk in their diet, not realising that it's actually the cause of a persistent symptom, typically eczema or problems with tummies, so things like diarrhoea, colic, reflux, even failure to put on the weight that you'd expect your infant to be putting on. All of those could be due to an underlying cow's milk allergy.
How does it go so sort of misdiagnosed?
Well, this is work from Allergy UK, who for some time have suspected that, particularly for children with delayed sorts of cow's milk allergy, that it's being missed really and not picked up as soon as we'd like. And as a consequence, children have these horrible symptoms sometimes of diarrhoea and colic and eczema for months and months and months before finally it becomes apparent that there's an underlying problem. And a simple change of milk formula makes an enormous difference. And the report really showed what we suspected, which was that parents know that there is such a thing as cow's milk allergy, but they don't know what the symptoms are, so they don't really know what to look out for.
Is the cause of cow's milk allergy known? I've heard people saying it could be down to the mother's diet when pregnant. Is this true? Quite an interesting one.
Yeah, it's a really important question because, of course, if we could find out what it was, then we could put strategies in to prevent it from happening. It doesn't seem to be related to what mums are eating during pregnancy, and there's been lots of studies looking at seeing whether what you eat in pregnancy, what you eat while you're breastfeeding, make a difference to the chances of your child having food allergy, and it doesn't seem to. And that goes for things like peanuts as well. There was government advice previously suggesting that, avoiding peanut during pregnancy and breastfeeding. That advice was withdrawn a couple of years ago because there wasn't any evidence to support it. Now, that doesn't mean that you should eat peanuts in order to, that doesn't help either. It just doesn't seem to matter either way.
So we can take the guilt away. A couple more questions I need to get through here. We've had one from Emma, and Emma says that my son has CMPA, so cow's milk protein allergy, but at the age of 1 seems to be growing out of it. If I have another child, are they likely to have CMPA too? So that's an interesting question.
Yeah, there's a lot of interest in how much of it is genetics, how much of it is environment, and it's a little bit of both. And if you've got one child with any allergic problem, you're more likely to have another one. If you've got allergy problems yourself, asthma, eczema, hay fever, food allergy, or your partner has, then you are more at risk of your child having those sorts of issues. But what issues they'll have is completely unpredictable. So the father with hay fever and the mother with eczema may have a child that develops food allergy, but might well not. Exactly. So all you pass on is an allergic tendency. That's it. And you may or may not pass that on. If you do, how it shows itself, it can be a number of different ways. So I think it's worth sort of bearing the allergy thing in mind a little bit more if there's already a history of allergy in your family. And that's one of the first things your GP would ask you.